Okay, let's unpack this. We all want our horses to be healthy, happy, and gleaming, right? But sometimes there's a hidden world of tiny adversaries at play, the ones you can't quite see until they're causing real trouble. Today, we're diving deep into equine ectoparasites, those external hitchhikers that make themselves at home on a horse's skin, hair, and sometimes even deeper. Our mission in this deep dive is to equip you with the knowledge to identify, treat, and prevent these often unseen challenges, drawing from a rich stack of notes and research on equine health.
And truly, gaining this knowledge quickly but thoroughly is absolutely key to proactive care. Think of it as a shortcut to being well-informed, ensuring you're not just reacting to problems, but actively optimizing your horse's well-being.
Right.
Understanding these parasites is crucial because they can range from simple irritants to causes of severe skin lesions, and some even transmit serious diseases. Knowing the who and the how for each one lets you be a much better detective when something's, not quite right.
So let's talk about these external troublemakers. We know they're living on the horse, feeding on things like blood, skin debris, or secretions. What's critical to remember is that they complete that entire life cycle right there on the horse, and they're primarily transmitted through direct contact. It's truly a world unto itself. First up, let's talk about the itchy inhabitants we can actually see, lice. These are small, flattened, wingless insects. You can usually spot them if you know what to look for. And here's a crucial detail for your barn. Horse lice are host-specific. That means they won't jump off your horse and infest your dog, cat, or you. They're strictly equine exclusive.
That host specificity is, an important starting point. Now, within horse lice, there are two main types. First, we have biting lice, scientifically known as Damlinia equinsters. Think of them as the surface grazers. They have a broad, blunt head and are typically yellowish-brown. They're quite quick movers and feed on skin flakes, hair, and sebaceous secretions. You'll often find them up on the forehead, neck, and the dorsolateral trunk that's essentially the sides of the body towards the back.
Oh.
Then we have the trickier ones, sucking lice, or Hematopenes asceni. These have a narrower pointed head and appear more bluish-gray. They're slower moving because they actually pierce the skin to feed on blood.
Ah, okay, so they're actually blood feeders.
Exactly. And this is a critical distinction, especially in young, old, or immunocompromised horses,
Yeah.
because heavy infestations of sucking lice can lead to anemia, which is, quite serious.
Right. And when you're inspecting your horse for lice, you can also look for their eggs, which are called nits. These are tiny, white, oval, and they're really stuck firmly to the hair shafts. Sometimes you'll need a little magnification to see them clearly. You'll commonly find them in areas like the mane, tail, forelock, neck, chest, and inner thighs. But in really heavy cases, they can spread all over the body. So if your horse is suddenly developing an obsession with rubbing its tail, it's time for a closer look.
Exactly. When it comes to clinical signs, you'll observe intense itching or pruritus, leading to the horse rubbing itself constantly. This can result in hair loss known as alopecia, a dull coat, skin abrasions, crusting, and even thickening of the skin. What's fascinating is their seasonality. They're significantly more common in winter months.
Why is that? Just the thicker coat.
Yeah, partly the thicker coat providing a better hiding spot, and horses are often stalled closer together in winter, making transmission much easier.
Makes sense. Okay, so from those visible, albeit tiny invaders, we now zoom in literally on the truly microscopic menace, mites. Unlike lice, these are tiny arachnids, usually invisible to the naked eye. You'll need a skin scraping and a microscope for a definitive identification from your vet, right?
Correct, yeah.
This is where your precise observation really becomes your most powerful tool, giving your vet the initial clues.
Indeed. We're talking about various forms of mange here. First, seroptic mange, caused by Seroptes equi. These are surface dwellers that are extremely pruritic.
Meaning super itchy.
Exactly, intensely itchy. You typically find them at the base of the mane, tail, ears, and under the forelock, though they can spread. The signs include severe itching, crusting, and thickened skin. It's worth noting that related species like P. hepatus and P. caniculi specifically cause ear issues, leading to head shaking and a droopy ear. While rare, this species is highly contagious.
Ooh, okay.
Then we have coreoptic mange, often called leg mange or feather mange, caused by Coreoptes equi. This is actually the most common mite in horses.
Ah, leg mange. I've heard of that one.
Yes. It primarily affects the distal limbs, especially in feathered breeds like draft horses or Friesians. It causes intense itching of the lower legs, making horses stamp, rub, or bite at their legs. You'll see hair loss, crusting, and thickened skin around the pastern and fetlock, those lower leg joints. A key point here is that Coreoptes can survive off the host for months.
Wow, months.
Yeah, which means environmental control is absolutely vital.
Right. Okay. What else?
Sarcoptic mange, from Sarcoptes scabi ivar equi, is particularly nasty. These are burrowing mites, highly contagious, and cause incredibly intense itching. It's important to highlight their zoonotic potential. They can cause temporary skin irritation in humans.
Oh, so humans can get it too, temporarily at least.
Temporarily, yes.
Yeah.
It typically starts on the head, neck, and shoulders, then spreads, leading to severe itching, rapid hair loss, dry crusts, and thick folds of skin. This is a notifiable disease in some regions due to its contagiousness and severity.
Got it. Nasty stuff.
And we also have demodectic mange, Demodex equi, which are follicle dwellers. Usually they're harmless unless the horse is immunocompromised. And finally, trombiculidiasis, caused by Trombicula autumnalis, also known as harvest mites or chiggers. This leads to papular dermatitis, small, red, raised bumps, and intense seasonal itching on the face, fetlocks, mane, tail, and sometimes the belly, especially in pasture-grazed horses.
You know, as you describe these different mites, what strikes me is how incredibly specific some of them are, affecting certain areas or even breeds, like those feathered horses you mentioned. Does that mean our diagnostic approach needs to be just as specific? Are there cases where misidentification is common, and what are the risks there?
That's an excellent question. Yes, their specificity is precisely why your initial observations are so critical. If a horse is intensely itching its lower legs, your mind should immediately jump to Coreoptic mange, Whereas if it's the mane flail, you'd think of something else, maybe a Pharoptes or even lice or sweet itch. Misidentification means delayed appropriate treatment, which allows the infestation to worsen, causing more distress to the horse, potentially more skin damage, and a higher risk of spread. Wrong treatment won't work, obviously, and might even be harmful in some cases. So yes, that precise observation of where the problem is your first and best diagnostic tool before a vet confirms it with, say, a scraping.
Okay, that makes a lot of sense. From the quiet, creeping menace of lice and mites, we now move to the more obvious yet still insidious attackers that arrive on wings. Ticks. These are larger, visible arachnids that attach to the horse and feed on blood. I remember once after a trail ride finding a tick the size of a grape. It's enough to make you itch just thinking about it. But beyond the ick factor, the disease risk is what's truly concerning, isn't it?
Absolutely. Their appearance can vary. They can be pear-shaped or oval and flat before feeding, but they become engorged and grape-sized once they're full of blood. Common locations on a horse include the mane, tail, armpit, groin, inside the ears, and behind the elbows, those sort of hidden spots. Beyond just local irritation, ticks are notorious for being vectors for numerous serious equine diseases. We're talking about Lyme disease, anaplasmosis, pyroplasmosis, which is actually a reportable disease, and tularemia.
Wow, quite a list.
It is. And let's not forget the rare but very serious tick paralysis caused by neurotoxins some female ticks release while feeding.
Yikes. And you'll find ticks are most active in the warmer months, right? So seasonality plays a big role in their presence. It's another clue for you as a horse owner.
Definitely. Spring and summer into fall are prime tick seasons.
And then we have flies. Oh, the flies. There's a wide variety of these winged nuisances that cause irritation through biting, swarming, or laying eggs. It feels like a constant battle, doesn't it?
It absolutely can feel that way. Let's break them down. Among the biting flies, we have stable flies, Stomoxys calcitrans. They look like houseflies but have a painful bayonet-like proboscis.
Ouch.
Yeah, they love to target the legs and belly, causing horses to stomp and tail swish, and they can transmit haberdema, leading to what are known as summer sores. Then there are the large, powerful, and painful biters like horseflies and deerflies, the tabanids. Those can transmit serious diseases such as equine infectious anemia, or EIA, and anaplasmosis.
The really big ones that take chunks out.
Those are the ones. Nasty bites. Then black flies, or gnats, or buffalo gnats. Simulium species are small, humpbacked, silent biters that swarm, causing crusty lesions in ears, and sometimes even systemic allergic reactions. And crucially, there are culicoid species, also known as noceums, or biting midges. These tiny flies have highly allergenic saliva and are the primary cause of sweet itch, which is technically called summer seasonal recurrent allergic dermatitis, or SSRAD.
Ah, sweet itch. That's a big one for many horse owners.
It is. It's a severe allergic reaction causing intense itching, significant hair loss, crusting, and thickened skin, especially on the mane, tail, ears, and ventral midline. That's the belly and chest area.
Right.
On the non-biting flies front, we have your common house flies, Musca domestica, which are mostly just annoying, feeding on secretions, And face flies, Musca autumnalis, which feed on ocular and nasal secretions and can spread eye worms.
Ugh, eye worms.
Yeah. Finally, we have bat flies, Gasterophilus species. These are fuzzy bee-like flies that don't bite at all.
They look a bit like bees, don't they?
They do. Instead of biting, they lay very distinctive bright yellow eggs on the horse's hair, typically on the legs, shoulders, abdomen, and neck. The larvae, or bots, hatch and migrate into the horse's mouth, then travel to the stomach, or, less commonly, the rectum, where they attach and develop.
Okay, so we've cataloged this rogues gallery of parasites. Now, the million-dollar question for every horse owner: what do we do about them once we've identified the culprit? You've zeroed in on the specific creepy crawly. What's your next move? Let's dive into the powerful strategies of treatment and prevention.
Right. Treatment is highly specific and always tailored to the particular parasite. It usually involves a combination of topical and systemic approaches. For lice and mites, for instance, we often use topical insecticides or acaricides. Pyrethrins and pyrethroids are common in shampoos, sprays, and pour-ons. They're broad spectrum.
Things you can buy over the counter sometimes.
Some, yes, but often vet-prescribed for specific issues or strengths. Lime sulfur dips in shampoos are also effective for mites. A word of caution: Amitraz is effective, but requires incredibly careful handling, as it can be toxic if misused and is actually contraindicated in horses. Fipronil is used off-label with caution in some cases.
Okay, good to know.
For a more systemic approach, ivermectin and moxidectin, which are oral or injectable dewormers, are highly effective against sucking lice, most mites like Cordyoptes and Sarcoptes, and botfly larvae. Think of it like a never-ending cycle. Even if you kill the adults, their eggs, called nits, are still hatching, so you need to hit them again with repeat doses.
Break the cycle.
Exactly. Usually every 10 to 14 days for 2 or 3 treatments to catch those new batches of baby parasites before they can lay more eggs. It's all about breaking that life cycle. And crucially, environmental treatment is vital. You must thoroughly clean and disinfect stalls, bedding, blankets, and grooming equipment, because some of these parasites can survive off the host for a period.
Like those coreoptic mites you mentioned.
Precisely. Hot water washing of blankets and isolation of affected horses are also key to preventing spread.
Okay, what about ticks? Getting those off seems tricky.
It does, and doing it right is important. For ticks, manual removal is a primary method. It's essential to use fine-tipped tweezers or a tick removal tool. Grasp the tick as close to the skin as possible and pull straight upward with steady, even pressure. This is crucial. Do not twist, squeeze, or burn the tick.
I've heard people suggest burning them off.
Yeah, don't do that. It can cause the tick to regurgitate pathogens back into the horse. Big risk. Always dispose of ticks safely, perhaps in alcohol or a sealed bag. Topical permethrin or pyrethrin-based sprays can also kill or repel ticks. Environmentally, simply mowing pastures and clearing brush along fence lines significantly reduces tick habitats.
Simple but effective. And flies, the bane of summer.
Ah yes, flies. Topical pyrethrins and pyrethroids are common in sprays and wipes, but physical barriers are also essential, especially for horses prone to sweet itch. Think full-body fly sheets, masks, and leg wraps. Gear them up. And environmental control is paramount here. Effective manure management, meaning frequent removal and composting, eliminates breeding grounds for house and stable flies. Eliminating standing water targets mosquitoes and gnats. You can also use fly traps and fly predators, which are tiny parasitic wasps that kill developing flies.
Interesting. What about those bot eggs?
For botfly larvae, you can manually remove the bright yellow eggs from the hair using a bot knife, or even just warm water and friction. For the larvae inside the horse, oral ivermectin or moxidectin are highly effective. You typically administer these after the first hard frost to ensure all swallowed larvae are targeted before they mature.
Timing is key there.
Very much so. And for sweet itch, caused by culicoids hypersensitivity, it requires aggressive fly control. Daily application of strong repellents, full-body fly sheets, and stabling horses from dusk to dawn during peak gnat activity, as culicoids are weak flyers. Fans and stalls can also help create airflow they dislike. Medically, corticosteroids can manage the acute allergic reactions, and sometimes antihistamines, omega-3 fatty acid supplementation, or even immunotherapy for long-term desensitization are used.
There's quite a few options for sweet itch management. It really connects back to the bigger picture, doesn't it? Preventing these issues is always better than simply reacting and treating them. It's about staying ahead of the game.
Absolutely. Key preventive measures include regular grooming and inspection to catch problems early. You're looking at your horse every day anyway. Excellent barn and pasture hygiene, like consistent manure removal and draining puddles, is non-negotiable. Regular application of topical repellents and insecticides during peak seasons is also important. Strategic deworming with ivermectin or moxidectin, typically once a year in late fall or early winter, helps control bots, sucking lice and mites, and should always be guided by a veterinarian's program tailored to your horse and region.
Not just deworming randomly.
No, definitely strategic, based on risk and timing. It's also wise to quarantine new horses to prevent introducing parasites to your existing herd. Good nutritional support bolsters the horse's immune system, making them more resilient to any parasitic challenge. And continuing with environmental controls like fans in stalls and screening barn windows, along with using protective gear like fly masks and sheets, creates a less hospitable environment for these pests. With these integrated strategies, the prognosis for managing ectoparasites is excellent if all horses on a farm are treated, though reinfection can occur with short-acting products if not managed proactively and consistently.
So what does this all mean for you and your horse? It means that managing ectoparasites requires a truly comprehensive, multi-pronged approach from vigilant identification to targeted treatment and consistent prevention. It's about being proactive, not just reactive.
Exactly. What's fascinating here is how truly interconnected the horse's health is with its environment, and how powerful the proactive steps we can take are. Understanding these details isn't just about problem solving. It's about truly optimizing equine well-being, boosting their comfort, and even their performance. This raises an important question, perhaps something for you to think about. Beyond just managing parasites, how might consistently observing and understanding these smaller interactions within a horse's environment, the bugs, the plants, the conditions, contribute to unlocking deeper insights into their overall long-term resilience and even performance?
That's a great thought to end on. Keep observing, keep learning.
And your horse will thank you for it.